Hi, my name's Danica, and I'll be presenting on rabies, Eastern equine encephalitis, Western equine encephalitis, and Venezuelan equine encephalitis. Just to give a little bit of background, I first wanted to point out why I had horses on the first slide, and that is because equine means having to do with horses, and since a couple of the viruses I am presenting on has the word equine in it, I just wanted to point that out. It is interesting because these viruses, the Eastern equine encephalitis, Western equine encephalitis, and Venezuelan equine encephalitis, all affect horses more than they do humans, but they're included because they have been affecting humans as well as of recently. And of course, these are all viruses, so there's no cure, and even there is no vaccine for most of them that are available to humans. They're all zoonotic, which means that it may spread from animals to humans, and they all could result in encephalitis. Encephalitis is caused by an accumulation of fluid in the brain. It causes swelling and can cause permanent brain damage or even death. Symptoms include headache, fever, seizures, weakness, light and sound sensitivity, impairment of speech or hearing, sleepiness, confusion, hallucinations, memory loss, and cognitive impairment or coma. Encephalitis can be deadly if not caught on early enough and too much damage is done to the brain. So I just wanted to explain the picture that I have on this slide a little bit. These are pictures of some scans of a man who had encephalitis in his brain, and the scans on the left are scans before he died. You could see the swelling where the arrows are pointed, and then the picture to the right is taken post-mortem, and you can see the permanent damage that was done to his brain as a result of the encephalitis. And if you read the little part on the bottom, it even says that that damage caused him to have lower extremity weakness. To give a brief overview of the central nervous system, I just wanted to point out the central nervous system consists of the brain and the spinal cord. The brain and spinal cord are protected by a triple layered membrane called the meninges. When encephalitis occurs, the meninges swell, and that is what could cause some of the brain damage. The central nervous system is responsible for gathering the information that comes in throughout the day and coordinating a response for your whole body. So as you can see, if there is a disease of the central nervous system that is plaguing the body, it could be very dangerous. Now we will discuss rabies. The causative agent for rabies is the rabies virus. It is enveloped negative single-stranded RNA from the family Rhabdovirus, which are known for their bullet shape, and genus Lyssavirus. They are 180 nanometers long and 75 nanometers wide. The cell is protected by an outer layer of glycoprotein, which helps protect the cell from the host's immune responses. It contains a dense arrangement of spikes on the outermost layer, which you can see in the picture. Once someone is infected with the rabies virus, the virus envelope fuses to the host's cell membrane, and after integration, the virus needs RNA to transcribe and translate its code to produce more viral pathogens. Incubation can be anywhere from 5 days to 2 years, but is more commonly within 3 to 12 weeks. The closer the bite is to the brain, the sooner the effects will appear because the virus has to ascend the central nervous system to the brain, and so the shorter distance that it has, the less time it will need. Rabies is most commonly contracted through the bite of an infected animal. However, it could be contracted by coming into contact with infected saliva that enters the body through an open wound or mucous membranes in the eyes, nose, or mouth. The virus induces a biting behavior that aids in its transmission to a new host. So on the picture you can see the person is being bit in the leg, which is far away from the brain, so it has to travel up the peripheral nervous system to the central nervous system, and then it could reach the brain, and once it reaches the brain and enters the salivary glands, this person is not very well off. They would be very sick at this point. Once rabies reaches the stage of clinical infection, the host rarely survives, but the first stage that they would go through would be the prodrome stage, which is flu-like symptoms that can last a few days to a week, and it includes fever, headache, anxiety, sore throat, cough, nausea, and vomiting. And then they would move on to the acute neurologic period, which includes confusion, aggression, convulsions, hyperventilation, difficulty breathing, hypersalivation, fear of water, hallucinations, photophobia, rapid breathing, insomnia, and paralysis. And I just wanted to go a little bit more in depth on the fear of water. This is because people at this point are going to have trouble swallowing, so when they are drinking water, they feel like they might actually drown in it. Following the acute neurologic period would be coma, and if someone isn't hooked up to a ventilator in time, following coma would be death. So, as I said before, once a person starts showing these symptoms, it is almost always fatal. But a way to attempt to diagnose is by performing multiple tests on a subject, which include using saliva, blood samples, spinal fluid, and skin samples. Tests done on saliva are using reverse transcription and the polymerase chain reaction, whereas serum and spinal fluid are tested for antibodies of the rabies virus, and skin biopsies are taken to inspect the cutaneous nerves in the hair follicles for rabies antigen. Rabies prevalence and mode of transmission has changed dramatically in the US recently. Before the 1960s, the majority of animal cases reporting were in domestic animals. Now, 90% of reported cases occur in wild animals such as foxes, bats, raccoons, and skunks. In the early 1900s, there were about 100 deaths per year from rabies, but now there's only about 2 deaths per year in the United States. Yearly in the world, there are about 60,000 deaths from rabies. 99% of human rabies deaths worldwide are due to bites from a dog. So, dog vaccination programs are very effective in reducing mortality from rabies, but they are very costly. Most of the $300 million the US spends to prevent rabies each year is spent on dog vaccination programs. So, this is why you could see that the United States in this picture is in yellow, meaning it has not very many cases, whereas other countries that may not be able to afford the vaccination programs that we have are in red, showing that they have many more cases of rabies each year. If someone thinks they have been bitten by an animal that could have rabies, they should wash the area that they were bitten in for 15 minutes as soon as they can, and then seek medical help immediately. The medical professional will then determine if rabies post-exposure prophylaxis is needed. Immediate dose of rabies immunoglobulin will be given to the person if their physician believes that they need it, and then they will be receiving a series of 4 rabies vaccines over a 14-day period. Now moving on to Eastern equine encephalitis, which is a little bit more common than Western equine encephalitis. The causative agent for Eastern equine encephalitis is an arbovirus, which is positive single-stranded RNA in the family Togaviridae and the genus alphavirus. It is a spherical particle that is 60 to 65 nanometers, and I thought it important to mention that there is not enough concentration of the virus in a human's blood to pass to another human, and I will explain that a little bit more in the disease mechanism slide. Eastern equine encephalitis has an incubation period of 5 to 15 days, and it is able to be transmitted to humans and horses because of a cycle that involves birds and mosquitoes. The Colcetta manilura mosquito is a mosquito that only bites birds, and it is the main source of transmission between birds. Once an infected Colcetta Melanura mosquito bites a bird and gives it eastern equine encephalitis, the only way it can be transmitted to humans or horses is if a different type of mosquito, one that bites both birds and humans, bites the infected bird and then bites us, the human. After that, humans and horses are considered dead end hosts because our blood does not end up having a high enough concentration of the virus to keep passing it along. So I included this image here. We've got the mosquito vector is the mosquito that only bites birds and it amplifies the virus within the bird population. And then you've got the bridge vector, which is the mosquito that bites both birds and humans. And that's the one that would then pick up eastern equine encephalitis from the bird and be able to give it to us humans or horses. Someone with eastern equine encephalitis may experience fever, vomiting, stiff neck, drowsiness, facial or periorbital edema, especially in children, or impaired respiratory function or excess salivation. So I just wanted to include this picture that shows the periorbital edema, which kind of looks like intense bags under the eyes. For diagnosis, a serum test can be done of the cerebrospinal fluid. The elevated protein levels would be examined, and neuroimaging showing brain lesions consistent with encephalitis, including neural destruction and vasculitis in the cortex, midbrain, and brainstem, but minimal involvement of the spinal cord would show. And then Eastern equine encephalitis virus specific IgM antibody would be present in the cerebrospinal fluid. People who are older than 50 years old and under 15 years old are at greatest risk for Eastern equine encephalitis. Also, people who live in swampy areas are at greater risk, although in the US only 11 cases have been reported annually recently. Most cases of Eastern equine encephalitis have been reported in Massachusetts, Michigan, Florida, Georgia, New York, and North Carolina, and this is because they are around freshwater swamps near the coast, or they're around the Great Lakes, and these are the ideal locations for the mosquitoes who would carry Eastern equine encephalitis. As of now, there is no human-approved vaccine for Eastern equine encephalitis. 33% of people who do get it die from it, and up to 30% of people who survive the virus are left with neurological sequelae, which means symptoms that linger, such as seizures, spastic paralysis, cranial neuropathies, and they're also left with cognitive impairment, which ranges from minimal brain dysfunction to severe dementia. Although once a person is infected, it is thought to be given them lifelong immunity. Now we will be talking about Western equine encephalitis, and this is also known as the sleeping sickness in horses. The causative agent is Eastern equine encephalitis, and it is an arbovirus which is positive single-stranded RNA in the family Togaviridae and the genus Alphavirus. They are 60 to 75 nanometers in length. This disease is transmitted by a mosquito bite, and funny enough, only by a female's mosquito bite. And the incubation period is from 5 to 15 days, and it has the same amplification cycle that I described in Eastern equine encephalitis, where the bird-specific mosquitoes amplify it within the bird population, and then a different kind of mosquito that bites both humans and birds can carry it between them. Symptoms include fever, nausea, vomiting, headache, loss of appetite, extreme tiredness, weakness, or confusion, and these symptoms are most severe in young children. IgM antibodies can be detected in blood samples in order to diagnose, but they could also use the ELISA, which is enzyme-linked immunoabsorbent assay. This diagram shows a sandwich ELISA, which can be used to detect Eastern equine encephalitis, but also Western equine encephalitis. The capture antibody is applied to the specialized absorbent plates, and then any excess is rinsed off. Then the sample from the patient is added and it will bind to the capture antibody. Any excess is also rinsed off. Then the detection antibody is added and it will bind to any existing capture antibody/sample duo. Then any excess is rinsed off. Then a substrate is added that reacts with the chromogenic ELISA assay and creates a colored product that can be observed to be able to diagnose the patient. In the past, Western equine encephalitis caused hundreds of human deaths and thousands of horse deaths. However, the virus has not been detected in mosquito populations since 2008 in the United States. In the 1970s, there were 209 human cases. In the 1980s, there were 87, and in 1990, only 4 cases were reported, and no cases have been reported in the United States or Canada since 1998. It used to be in America and Canada anywhere west of the Mississippi River. Most common in summer months, and some southwestern counties in India have even shown Western equine encephalitis in irrigated farmland. There is no antiviral drugs or human-approved vaccines. There is only a vaccine for horses, and symptoms can be treated with over-the-counter medicine, IV fluids, and anti-inflammatory medicines. Lastly, we will be discussing Venezuelan equine encephalitis. This virus is similar to Eastern and Western equine encephalitis in respect to that it is enveloped, positive, single-stranded RNA arbovirus from the family Togaviridae and genus Alphavirus. It is also spherical and 60 to 75 nanometers in diameter, but the interesting thing about it is that it can be enzootic or epizootic. It used to only be transmitted between insects and rodents, but a change in its genome, specifically the amino acid sequence change in the E2 envelope protein, has allowed it to infect humans and horses as of recently. This same type of change in the envelope is what caused the virus to be able to be transmitted by aerosol as well. So now, this virus is a biosafety level 3 and requires specially equipped lab to work with it. Both the US and the USSR experimented with using Venezuelan equine encephalitis virus as a biological weapon. The USSR combined the genome of the Venezuelan equine encephalitis virus and the smallpox virus to create a new kind of pathogen. Only 10 to 100 microorganisms needed for infection, so that is why it is considered a good candidate for a biological weapon. And there have been 150 accidental laboratory exposures, so that is why it needs to be a biosafety level 3. And if you just wanted to look at the picture I included at the bottom, it's kind of a map of the genome, and you can see the E2 portion of it that is responsible for the mutations. This virus has a somewhat shorter incubation period. It is only 1 to 5 days, but the way that it infects its host is about the same, where its envelope embeds itself into the host membrane and uses RNA to translate and transcribe the virus, just like in Eastern equine encephalitis and Western equine encephalitis. In the wild, it can only be transmitted through the bite of an insect, but in the lab, there has been cases of aerosol transmission, as I mentioned. One instance is in 1959. The USSR scientists accidentally dropped a vial of the dried virus in a stairwell, resulting in 20 human cases and proof that it could be transmitted as an aerosol. Unlike Eastern equine encephalitis and Western equine encephalitis, horses are no longer a dead-end host, which means that they can harbor enough virus in their blood to allow a mosquito to bite them and pass it on to another horse. Most people only experience flu-like symptoms when they contract Venezuelan equine encephalitis, but sometimes they could experience more severe symptoms like fever, depression, weight loss, dehydration, weakness, paralysis, difficulty swallowing, gait abnormalities, seizures, encephalitis, and edema. Diagnosis can be done with blood work, the ELISA test that I was talking about earlier, a polymerase chain reaction of cerebrospinal fluid, or it can be detected with a throat swab if contracted by an aerosol. This disease is mostly prevalent in South America and Mexico, but it can also be in southern states of the United States. The first major outbreak was in 1962 and lasted to 1963, where there were 14,000 cases reported in Venezuela. 90% of horses who contract the mutated strain do not survive, and mortality in humans is 1%, with only 14% experiencing any neurological symptoms. As of now, there is no human-approved vaccine or antiviral drugs for this virus in the United States. However, there has been an investigational vaccine being produced that is only available to military personnel at high risk for contracting the virus because they work in close proximity with it in the labs. It is not fully effective, though, especially if the virus is contracted through aerosol, and some have reported side effects from this vaccine. Once infected, however, it is thought to provide lifelong immunity. These are my references. Thank you so much for listening, and don't be afraid to shoot me a message on Utica Engage if you have any questions that I can try and answer.